Hi, my name is Sophie Schulke. I'm a third-year medical student from Nova Southeastern University. Today I will be presenting my poster titled Avoiding Complications in Acute Cholecystitis with Choledocholithiasis in a Phrygian cap gallbladder. This case is interesting because it highlights the diagnostic challenges presented by patients with anatomical variations of the gallbladder. So acute cholecystitis is a common and potentially life-threatening condition characterized by inflammation of the gallbladder. This is often due to obstruction of the cystic duct, typically by gallstones. The presence of choledocholithiasis, which is gallstones in the common bile duct, complicate the clinical picture and require additional management. The treatment for choledocholithiasis typically involves ERCP to remove the stones. Once the obstruction has been relieved, the patient is stable. A laparoscopic cholecystectomy is generally recommended to remove the gallbladder and prevent future episodes of cholecystitis. Gallbladder folds occur when the gallbladder wall folds onto itself, often affecting the posterior wall. A common type of folded gallbladder includes the Phrygian cap, where the fundus of the gallbladder folds over the body. Ultrasound may show acoustic shadows from these folds, potentially mimicking polyps or stones, so a thorough assessment in all planes is essential to differentiate normal variants from pathology. In this case, a 43-year-old female presented with complaints of right upper quadrant pain, which began 1 week prior and worsened over 2 days. She described the pain as constant, non-radiating, and exacerbated with eating. She stated pain was associated with nausea and 2 episodes of vomiting the previous night. The patient was also febrile for 1 day prior to admission. On admission, vitals were blood pressure of 104/66, heart rate 61 beats per minute, respirations 18 beats per minute, and saturating on room air at 96%. Pain was 0 and she was afebrile. Physical exam was unremarkable apart from right upper quadrant tenderness. On admission, labs were normal with the exception of monocytes, which were high at 0.68. Additionally, the patient had elevated alkaline phosphatase, ALT, AST, and globulin. Albumin to globulin ratio was low at 1. Below are 4 significant image findings, the first being ultrasound showing common bile duct dilation to approximately 11 millimeters without evidence of radio-opaque choledocholithiasis. Image 2 is a sagittal CT showing distended and folded gallbladder Phrygian cap. Image 3 is an MRCP showing 2 things: imaging features suggestive of acute calculus cholecystitis, 2 common bile duct filling defect consistent with choledocholithiasis. And image 4 is a HIDA showing evidence of acute cholecystitis or cystic duct obstruction. After imaging aided in the diagnosis of acute cholecystitis with choledocholithiasis, ERCP was successful in removing bile duct stones. A same-day laparoscopic cholecystectomy was also performed to prevent future reoccurrence of cholecystitis. Following 3 days of observation, the patient showed normal vital signs, decreasing epigastric pain, and decreased lipase levels. The patient was discharged home on day 7 with acetaminophen, omeprazole, and instructions to follow up with her primary care provider within 3 days and with general surgery within 14 days. Figure 2 shows the ERCP post-removal of gallstones in the common bile duct. In conclusion, the decision to not proceed with surgery immediately but to first address choledocholithiasis through ERCP was the correct approach consistent with current guidelines and literature. This approach minimizes complications, optimizes patient outcomes, and highlights the importance of a multidisciplinary approach in managing complex cases of acute cholecystitis. Imaging was essential in guiding this stepwise treatment approach, especially considering the patient's anatomical variation of the Phrygian cap. The case reinforces the need for early and accurate diagnostic techniques in managing complicated biliary diseases. Thank you.